This presentation highlights some key findings from the STIRN Inaugural meeting entitled The Changing Landscape of Sexually Transmitted Infections in Nova Scotia, an Integrated Approach. STIRN stands for Sexually Transmitted Infections Research Network and is part of the Gender and Health Promotion Study Unit at Dalhousie University. Both the study unit and the research network are directed by Dr. Jacqueline Gahagan. The meeting took place on December 5th and 6th, 2013 in Halifax, Nova Scotia. 28 delegates from across the province representing the community, public health, and research sectors were present at the meeting, as well as 5 student trainees and 3 organizing members also attended. The meeting was funded by the Nova Scotia Health Research Foundation. The purpose of this meeting was to discuss the latest evidence on STI outbreaks in Nova Scotia, to strategize on ways to advance integrated approaches to STIs that better meet the needs of hard-to-reach populations, as well as to establish mechanisms for health research and knowledge exchange that's necessary for sustained research, policy, and practice in addressing STIs in Nova Scotia. Our experts, students, and organizers took part in several discussions over the 2-day meeting. Some of those topics included advancements in prevention, testing, and treatment, and use of technology, social determinants of health, and STIs and HIV, the role of pleasure-based sexual education in our education system, integrated approaches to STI prevention, and the complexity and definition of STI prevention, sexual health, and healthy sexuality. Some of the conclusions that we came to included that there is a need to focus on STI and HIV prevention in a holistic and life course manner. Now, this includes addressing STIs and HIV prevention from within the larger understanding of sexual narratives. Secondly, technology plays a crucial role in the sexual lives of individuals and should be integrated into prevention, treatment, and care of STI and HIV. And last, there is a need for more focused and evaluated approaches that engage men and boys throughout the life course. The next steps for STIRN include developing some researchable questions and engaging in some scoping reviews based on the conclusions that were drawn from this 2-day meeting. The group also intends on submitting a letter of intent to the CIHR competition entitled Exploration of Sexual Health Narratives of Boys and Men Across the Lifespan. And a third possibility for this group is to develop and evaluate an intervention based in social media or using smartphone apps for a university population in Nova Scotia. For more information on these proceedings or to become involved in projects related to STIRN, please contact our research coordinator, Kirk Verlot, at gaps@dal.ca.